to this side event of the 65th session of the United Nations Commission on the Status of Women. Thank you for participating, for being here from different parts of the globe. My name is Manuela Brandt, and I will be moderating today's session on gender equality and the socioeconomic consequences of the COVID-19 crisis. Before moving on, just a few housekeeping rules to everyone who is joining us through Zoom. I would please ask you to have your name listed on your Zoom account and keep your microphone mute so that we can hear the speakers in the best possible condition. I can see that this is already the case, so just keep it as you are. The camera is optional for attendees, while the speaker's camera will be on for us to be able to see them while we listen to them. This event is live streamed and available to rewatch on YouTube. Any questions can be placed during the event in the chat box so that we get to them after we listen to our panelists. We have some time after the speakers to questions and discussions, so I invite you to please use the chat box and make sure this is as interactive a session as can be. It is my pleasure now to give the mic for opening remarks to first Rosa Monteiro, Portuguese Secretary of State for Citizenship and Equality for the Presidency of the Council of the European Union, and then afterwards to Helena Dalli, European Commissioner for Equality.
Dear Commissioner Helena Dalli, dear participants, Azale Regner, Deputy Executive Director of UN Women, Caroline Schill, Director of the European Institute for Gender Equality, Guy Ryder, Director General of International Labour Organization, Ana Sofia Fernandes, Vice President of the European Women's Lobby, Manuela Brandt, our moderator from the Center for Studies for Social Intervention in Portugal, and all those joining us remotely. It is with great pleasure that I welcome you today. I would first like to thank the European Commission and the European Women's Lobby for this co-organization with the Portuguese Presidency on such an urgent topic, as well as to those who put this meeting together, our Portuguese mission to the United Nations, the European External Action Service, the European Delegation to the UN. And I thank all speakers for their availability to share their knowledge and expertise. Just as past crises, this pandemic is not gender neutral. As mentioned by the UN Secretary General, COVID-19 crisis has a woman's face. The UN policy brief mentions that across every sphere, from health to the economy, security to social participation and protection, the impacts are exacerbated for women because they are women. Violence against women and girls emerged as a shadow pandemic. The risk of violence increased as confinement measures were implemented in all countries. Also, the crisis' socioeconomic impacts reflect persisting substantial differences between women and men, from horizontal segregation across sectors and professions, to teleworking opportunities, to the unequal division of unpaid care work. I take this opportunity to thank the European Institute for Gender Equality for the fundamental research that they have conducted at the request of the Portuguese Presidency on this exact topic. It gives us a clear picture of what is happening in the EU. Women are overrepresented in hard-hit economic sectors and in much more precarious job situations, more part-time jobs, temporary and seasonal jobs. They saw a significant decrease in their hours worked within main jobs, and employment reductions affected mostly young women. Women also faced an increase in the share of the unpaid care work connected to school closures and reduction in the supply of childcare and dependent care services during lockdowns. This threatens women's employment gains and reinforces gender stereotypes, with particular impacts on single mothers. Also, women are overrepresented in essential sectors, namely health, care, education, and cleaning. This meant increased work intensity, more health risks and stress, and more work-life balance difficulties. On the other end, teleworking risks creating new inequalities connected to the existing gender digital gap, which limits women's participation in the digital economy and their ability to meet remote work demands, for example. This is a global warning that COVID-19 can reverse the limited progress that has been made on gender equality and women's rights. Moments like this show the urgency of having a gender perspective in the policies that we adopt. These policies must respond not only to immediate impacts, but also to structural inequalities which have been exacerbated by this crisis and enable women to participate in decision-making. Therefore, recovery plans must be gender responsive and place gender equality at the center of economic and development models. And to enable a close and accurate monitoring, they must ensure mechanisms based on data disaggregated by sex in their various indicators. So I thank Commissioner Dalli for ensuring that this mainstreaming is mandatory in the preparation of national recovery plans, also in line with the EU gender equality strategy and necessary to ensure the European social model. This objective and this approach are conditions to ensure an accelerated implementation of the Beijing Declaration and Platform for Action and the Sustainable Development Goals. This must be addressed as a collective and shared responsibility. I thank you very much and have a productive debate.
Thank you very much, Secretary of State. I now invite the European Commissioner for Equality, Helen Azale, for her opening remarks.
Thank you for this debate. Dear friends, this pandemic has taken its toll on jobs in female-dominated sectors, as we have been hearing. According to IGES study, 1.5 million women lost their jobs in these sectors across the EU, accounting for 40% of the total job loss for women. With the closing of schools and daycare centers, most EU member states have introduced special parental leave and teleworking. While this is a good work-life balance solution for all parents, figures show that women have still shouldered the greatest burden of home and care duties. And despite men taking on more care duties than before, women's share of unpaid work has increased. Teleworking is a necessity to keep the economy going while in lockdown and keeping people safe. But with homes turning into multifunctioning spaces for offices, schooling and leisure, juggling care with work has become a struggle, especially for those parents with small children. A Eurofound survey shows that 30% of women with small children found it hard to concentrate on their job because of family duties. Only 16% of men said the same thing. Member states must have gender-responsive policies and make sure that women are part of their recovery plans. European policy tools and financial instruments can help such a gender-responsive recovery. Earlier this month, as part of our gender equality strategy, we adopted a proposal for binding pay transparency measures. The aim is to empower workers to enforce their right to equal pay and to address the systemic undervaluation of women's work. EU member states must also transpose the Work-Life Balance Directive into their national laws by 2022. The Work-Life Balance Directive complements the work on closing the gender pay gap and inequalities on the labor market. It encourages working parents and carers, women and men, to take family leave and work flexible hours. To allow more women to join the job market, the Commission will provide funding to make sure that affordable and high-quality care services are available. We are monitoring this situation in member states yearly through the European semester. The lack of progress in women's share in decision-making is also concerning. Across the EU, it remains slow and uneven, be it in politics or business. Facing the dire consequences of this pandemic requires extraordinary measures and the best use of all our talent. Hence, adopting the proposed rules setting targets for female representation on corporate boards is still high on the Commission's political agenda. The Commission will also continue to support EU member states in developing and implementing better strategies for increasing the number of women in decision-making positions. We will not overcome this pandemic without addressing together the structural inequalities that have worsened during the crisis. Finally, I thank the Portuguese Presidency for putting gender equality high on the political agenda, and IGE for providing us with the studies and data to back our policy proposals, and the women's organizations for their work in these difficult times and reporting on the realities on the ground. I thank you.
Thank you, Commissioner. Thank you both for the opening remarks, already signaling specific problems and solutions that we will want to discuss further. And of course, I believe that the relevance, the urgency of this discussion is now clear to all. So it is my duty to announce the discussion panel of this session. We will have four speakers. We will start by Åsa Reinier, Deputy Executive Director of UN Women. Secondly, we will listen to Caroline Scheele, Director of the European Institute for Gender Equality. Thirdly, Guy Ryder, Director General of the International Labour Organization, will deliver his message by video. And fourthly, Ana Sofia Fernandes, Vice President of the European Women's Lobby. I thank you very much, the four of you, the three of you in this case, for being here and sharing your comments, your concerns, and your views on this important topic. We will try to give each speaker about 10 minutes so that we then have some time left for questions and debate and to get back to the three of you also to answer the comments from the audience. So let's start right away, and I invite Åsa Reinier to take the floor, please.
Thank you so much for having me, and I want from the outset to thank the Portuguese government and the Portuguese UN mission here in New York. We have an excellent working relationship with them during the presidency and also at other times. Thank you so much, Commissioner Dalli, Commissioner Jourova, my UN colleagues, as well as the European Women's Lobby. As a former cabinet minister in an EU country, I am perhaps extra happy to be here today. The topic today is also extremely urgent and important because we know that women and girls have been socioeconomically harder hit by the effects of the COVID crisis. And this against a backdrop, as we already heard, of rising income inequalities in general, but also between women and men, wealth disparities, and extreme poverty, which is rising all over the world, as well as the climate and environmental emergency. Women and girls worldwide occupy most of the jobs which were hardest hit by the economic crisis. We call them feminized sectors, which are characterized many times by low pay and poor conditions. They lost their jobs to a larger extent than men did. Women are also on the front line, as 70% of the world's healthcare workers are women, and more more susceptible to infection. I'm sorry, I'm hearing some noises. I don't know if it's possible to do something about that. Thank you.
Please continue. Sorry.
Yeah, thank you very much. So women are 70% of the world's health workforce, and they have been literally saving the lives of the rest of us. But I think that normally in relation to economic theory, you would expect that wages go up and that benefits improve when there's a lack of workforce and a big demand. But in this case, as far as we know, that has not yet happened. So also 740 million women in the informal economy worldwide with little or no social protection or unemployment benefits are and were particularly affected by the crisis. In addition to that, and it's also linked to this, women and girls' unpaid care and domestic work has increased dramatically due to lockdowns and closure of schools and childcare centers. Emerging evidence shows that women with children have experienced the sharpest drop in employment losses. And sometimes, even when they had a job, they had to leave it in order to be able to respond to the new COVID crisis-driven needs to stay at home, which women took on to a much larger extent than men. For example, in the US, 1 in 4 women who lost their jobs during the pandemic said it was because of lack of childcare. At the same time, pandemic response and recovery efforts have unfortunately so far been largely unresponsive to women's rights and needs. UNDP and UN Women have gone through the COVID responses that governments all over the world have come up with. We went through all the measures, and unfortunately, not even 20% actually respond to women's economic security, the unpaid care needs, or the domestic work situations. In turn, we know that countries that have made concerted efforts to support sectors with a high proportion of women workers have been more resilient in protecting against lost income and falling labor force rates. And so have countries where flexible work arrangements and parental and sick leave schemes have been established or expanded also come out better. So we believe that investments in gender-responsive social protection and in the care economy must be at the center of COVID-19 response and recovery efforts. Economic recovery strategies that strengthen the coverage and quality of care services yield multiple returns by creating decent jobs in the care economy so that people, women, can get back to work. Secondly, to support women's re-entry into the labor force in all possible ways. Thirdly, to protect the health, safety, and well-being of children, older persons, and persons with disabilities, since these needs otherwise are often expected to be solved by women who are also needed and want to take up paid work. Non-governmental actors such as women's organizations and civil society, and you are here today as well, should obviously, it's your job, monitor, ask for transparent policies, monitor them, and to advocate to policymakers, employers, and other decision makers for gender responsive recovery measures. It is very much needed, and your questions and your demands are very important to us who can also push for more to happen. We also know at the same time that this is not necessarily so easy for civil society and NGOs, since they are themselves in need of greater support from governments, aid agencies, and donors. So although we have a lot to work with, we also do think that we have an opportunity to together address these issues, use the data and evidence that we have to together build back better. So thank you so much for having me here today, and I wish you all great discussions. Thank you.
Thank you very much for your comments and contributions, and the global view and the various aspects that I think we will be interested in discussing further. Let me give the word now to our second speaker, who is Caroline Schreller, Director of the European Institute for
Thank you. Thank you for giving me the floor. And it's a pleasure to be in this side event. And I want to start with a mental exercise. Let us imagine the entire populations of Denmark and Latvia are working for free. 7.7 million people working full-time to power the national economy, but without being noted in the government's balance sheets. It doesn't sound right, does it? Well, this was the situation in the EU before the pandemic, with 7.7 million women unable to take up paid work because they were taking care of children and aging parents. Although this unpaid care work doesn't show up in government's balance sheets, it has value to the economy. Children are future taxpayers, and older people will be looked after by the state, if not by their families. Globally, the value of unpaid care work has been estimated at around 9 trillion euros each year. I wanted to start with this mental exercise to show that women and men did not enter this crisis on an equal footing, and that women are therefore facing more stumbling blocks on the road to recovery. We are already seeing larger shares of women than men leaving the labor market completely. Out of people who were unemployed in the first quarter of 2020, on average, 40% of women stopped looking for a job in the second quarter of 2020, compared with 33% of men. These figures are much higher than in 2019. Just as 7.7 million women were kept out of the labor market before the crisis because they were busy working for free, so too are they now leaving the labor market partly due to unpaid care responsibilities. During the pandemic, women have been doing an average of 35.7 hours of unpaid care work a week. That is almost 2,000 hours a year, which is more or less what you give to a full-time job over the course of a year. This can, of course, make it difficult to find time for paid work, as was the case for 7.7 million women before the pandemic. It can also eat into the time reserved for paid work, with many juggling care responsibilities alongside jobs. To make the recovery fair, we need to make unpaid care work visible. We cannot keep relying on the free labor of women to power this invisible part of our economy. We need to make care count. First, we need a change in the home. During the pandemic, men took on more of the care load than usual, which is a good sign. To make sure this positive change stays, countries should earmark healthy amounts of parental leave for all fathers. Second, people must have access to affordable professional care services. Europe is aging, so the need for these will only get bigger. Last, caring needs to stop being a professional and financial sacrifice for those providing care. To do this, countries could make part-time and temporary work, which are types of work frequently used by carers, more secure through proper eligibility for social security. Unless we recognize the value of care in our recoveries, I fear we will be here at the Commission on the Status of Women in 5 years' time, lamenting the fact that 10 or 15 million women are blocked from paid work because they are working for free. Let us hope it doesn't get to that. It is a good thing that EU member states will have to show how their economic recovery plans serve gender equality when applying to access the EU's money for recovery. It's a small win for gender equality that will require a moment for thought before we take action, a moment for assessment, a moment, I hope, to see the invisible economy and recognize its value. Thank you.
Thank you. Thank you very much, Kathleen. I am sure that your mental exercise has been quite significant to understand the lack of recognition of this form of work, unpaid care work, mostly by women who our official administrative service label as inactive persons who are unable for employment when in fact they are all but inactive. They are sometimes the most active of us all. So I think that's important. Let me just add that the European Institute for Gender Equality has been preparing a research note requested by the Portuguese Presidency of the Council of the European Union on the impacts of the pandemic on gender equality. For those of you who don't know it already, this is an important note. I think some preliminary results have been presented and discussed last week. And I believe that the detailed analysis that is being done by the Institute is indeed a major contribution for public knowledge and also for policy making to make sure that the responses to the pandemic bear in mind and monitor closely the effects that they have directly or indirectly on gender equality. So thank you very much again. This is the moment to listen to Guy Ryder, Director General of the International Labour Organization, who unfortunately could not be with us today and will be delivering his message by video. So I ask our technical team to please please let us see and listen to the video, please.
The COVID-19 pandemic has completely changed our world. It's changed our lives and the way we work, and no one has felt these changes more than women. As COVID-19 continues to affect lives and livelihoods around the world, we can already see that the pandemic and its economic fallout are having a regressive effect on gender equality. Women have borne the full impact of the pandemic. 64 million women have lost their jobs during this crisis, and women have seen a sharper decline in hours of paid work compared to men. They have had to do more housework and spend more time, unpaid time, taking care of their family. As a result, women have worked harder at home, but have earned less and saved less. They've become poorer, and they have undergone more violence and harassment. Now, even before the pandemic, progress towards gender parity had been slow and uneven. Major gender gaps remained across the world. And now, without deliberate action to address the disproportionate impact of COVID-19 on women, there's a risk that progress could go into reverse. So we need to act now, because if we don't, we could run the risk of losing the gains so painfully acquired in recent decades. And we could exacerbate gender inequalities in the labour market, because problems faced by women are not just problems that concern women, they are problems for society as a whole. Countering the negative impact of COVID-19 will require political will, it will require a collective effort, it will require solidarity, and it will also require a strong and renewed social contract. And to achieve all this, we need to prioritise job creation that benefits women and men equally, to invest in universal care policies to support women and workers with care responsibilities, advocate for more women leaders, and ensure the dignity and safety of all women and men in the labour market. And this will require strong, transparent and sustained leadership, with women at the heart of decisions. Governments, employers and workers' organisations will need to drive change through social dialogue on gender-inclusive policies. And taking these steps would improve social and economic outcomes for millions of women globally and help boost economic growth. It would also help change widespread attitudes about women's role in society. New initiatives are already happening. This year, the Commission on the Status of Women is calling for the full and effective participation of women in decision-making in public life, and the elimination of all forms of violence and harassment. The European Union's recent commitment, obliging its member states to include gender equality in investments funded from the Recovery and Resilience Facility, is a good step in the right direction. But this is not enough. We need to be ambitious to make the future more equal, to go further and faster. I call on rapid ratification and implementation of ILO Convention number 190 on violence and harassment in the world of work. That would send a powerful message to the world that we mean what we say. With gender equality, we can build a better future. But the journey ahead is neither simple nor easy. We stand at a crossroads that will determine our success or our failure. More than ever, we need to take the measures that should have been taken a long time ago to ensure that women have a fair share of employment opportunities. Because allowing the status quo to prevail, leaving millions of women without a future, is just not an option.
Thank you for this contribution too. Before with this contribution, which has brought some additional ideas and remarks. Before I give the floor to our next speaker, let me just remind you that you are all invited, all of those who are listening to us through Zoom, to contribute with questions or comments in the chat box. This can be questions to specific speakers, general questions or reflections, opinions that you would like to hear from the speakers, or concerns or ideas that have not been addressed so far. So feel free to contribute in that way. Well, now let's listen to Ana Sofia Fernandes. She is the Vice President of the European Women's Lobby.
Good morning, good afternoon. On behalf of the European Women's Lobby, I would like to thank you, particularly the Portuguese Presidency of the Council of the EU, for this event jointly organized with the EWL and also the European Commission. We, the European Women's Lobby, we are the largest women's NGO in the European Union. We represent more than 2,000 women's associations from the 27 EU member states, accession countries, as well as the UK and Iceland. Our mission is to advance the rights of all women and girls in Europe to achieve a feminist Europe. Our members continue to report the devastating impact of COVID-19 and continues this devastating impact to have on women and girls throughout Europe. Women's civil society organizations have continued to fill the gaps in service provisions and in supporting women during the difficult pandemic context, and often without adequate resources. 1 year ago, the world turned upside down as the pandemic spread throughout. Our heartfelt thoughts and solidarity go to everyone who has been affected by COVID-19. But this was also a wake-up call, which brought to the forefront the pre-existing inequalities in our society, particularly inequalities between women and men. We saw the impact of a decade of austerity measures and how those have impacted on public services, in which the majority of the workers are women. We cannot allow this to happen again. Looking forward, we need an holistic gender equality recovery strategy to ensure that women and girls will not pay the price of the long-term social economic consequences of this pandemic. So, in this context, we call for a gender equality recovery strategy. The pandemic provides an opportunity and an invitation to rethink the current economic system from a critical feminist perspective. The European Women's Lobby Purple Pact, published just at the beginning of last year, before the pandemic, was declared it is very timely, and it calls for a feminist economic model. This means a vision of a truly sustainable economy that is equally beneficial to all women and men, to truly recognize the value of women's care work that has always, in fact, been the backbone holding up societies. We cannot return to the past, as neoliberal economic policies fixated on growth and GDP. Those exclude women's unpaid contribution to the economy. It is a system that is not working, and it has shown its limits. We believe that the future requires a more stringent gender equality approach to economic policies, economic governance, and public spending. Gender equality and economic policies go hand in hand, and we must finally reconnect the two. Since the beginning of the pandemic, the issue of care has never been so visible, and investing in the care economy has become a demand from all actors, as we can see. So it is now time to turn the words into action. We need a care deal for Europe. We have many opportunities at hand at the moment for this to happen. In particularly, as already said, the Recovery and Resilience Facility that the EU has adopted as part of its next generation EU recovery strategy. As member states are drafting and finalizing their national recovery plans right now, to enable them to benefit from the unprecedented financial facility, consultation with women's organizations is key. And we expect that equality between women and men, and in particular investing in care, to be overarching priorities. We are very encouraged by the Council conclusions of December 1st, 2020 on tackling the gender pay gap, valuation and distribution of paid and unpaid care work, which very clearly shows a consensus among the member states on the issue. Therefore, we call on all the actors involved to ensure that the implementation of these conclusions are mirrored in national recovery plans. These include the two-pronged approach, investment for the provision of public infrastructure to meet care needs across the EU and the life cycle, and a framework to ensure the implementation of the Work-Life Balance Directive, enabling both women and men to work and to share care responsibilities. Investing in a robust health and care infrastructure must also go hand in hand with ensuring equal access to social protection for all, particularly the most marginalized, to ensure no one is left behind. For instance, undocumented migrant women and girls, those affected by prostitution, women with disabilities, older women. We call on the European Commission to reject national recovery plans if they do not contain a robust gender equality dimension and consultation with women's organizations having done beforehand. Looking forward, we urge the political actors at all levels to adopt gender budgeting, which requires leadership and long-term commitment. There can be no going back to the past. We need to ensure that public spending is meeting societal commitments to achieving the outcome of equality between women and men. Gender budgeting is the way forward, particularly as resources become scarce, and it is most urgent than ever to ensure smart spending, which not only makes economic sense, but is a human right imperative. We cannot no longer wait. We need to act now. We welcome the recent proposal of the European Commission on pay transparency. This provides an excellent opportunity to value the sectors where women work, particularly the care sector, including health and social care, to improve pay and working conditions, and to close the persistent gender pay, lifelong earnings, pension, and poverty gap. We expect that equal pay for work of equal value will become a priority, and to recognize that women have been undervalued for too long in paid and unpaid care work. We have now other instruments at our disposal, which must serve as an engine towards a gender equality recovery strategy. These include the Gender Equality 5-year strategy adopted a year ago, just a week before the pandemic, and which remains a blueprint for social forward. And most recently, the action plan of the European Pillar of Social Rights and the forthcoming European Social Summit to be held in May this year. Both are opportunities to ensure inequality gaps between women and men in the domain of care, unemployment, and access to social services are addressed. A gender equality recovery strategy would not be effective if it does not address as well the shadow pandemic, namely the persistent structural male violence against women and girls. And in this context, we call for the following. The EU must ratify the Istanbul Convention, the most comprehensive legislative instrument in Europe that addresses specific forms of violence against women and girls. And we are very pleased that this is a priority for the Portuguese Presidency of the Council of the EU in anticipating of the Court of Justice ruling, which is expected soon. We also call for an holistic approach to tackle the full continuum of violence against women and girls. And this requires including violence against women and girls as an EU crime, covering all forms of violence against women and girls. In fact, an EU directive on all forms of violence, including sexual exploitation and online violence. This would ensure equal and the highest standards of protection for all women in Europe, irrespective of where they reside or their legal status. And violence against women cannot be dissociated from women in leadership. Particular emphasis on online violence against women and girls in public life, specifically women in politics, whom we know are disproportionately affected. Online violence has consequences outside of the online space, which is a tactic to silence women and to push them out of the public space. It is crucial that online platforms are held accountable and are liable for hosting or facilitating in any explicit illegal contact and illegal activities, and to do more to address the harmful contact. And governments must take responsibility in outlining a clear legal framework to which platforms must align. And this is an absolute priority moving forward, as the pandemic has made it worse for women and girls, particularly as online contacts are the ones we all have now, in the absence of physical contacts, and telework has increased. All women and girls all over the world must be enabled to live a life free from violence and free from the fear of violence. A gender equality recovery must be built on feminist leadership. While we welcome the leadership at the EU level, in particular, the first ever female president of the European Commission, and also parity among the executive body of the 27 commissioners, we nevertheless call into question representation of the women on the Future of Europe conference, referred to as a pan-European democratic exercise, in which only one woman was designated. The future must include women on an equal basis with men. Strengthening women's leadership in public and political spheres and all areas of life require binding measures, including quotas, both for economic decision-making, on politic lists, and as part of the post-COVID-19 recovery strategy. Because looking forward, we must remember the words of Simone de Beauvoir, who warned us 70 years ago that we should never take our rights for granted, and that all it takes is a crisis of any sort to roll back these rights. We must remain vigilant in our lives. We expect and invite our political leaders to take action urgently. We believe that change is possible and that political will is critical to ensure that women will not pay the high price of the pandemic. As women's organizations in Europe, we are ready to work with you. We expect you to work with us, and that we have the resources and the means to continue a meaningful dialogue to make sure no woman or girl is left behind. Thank you very much.
Thank you. And then thank you for your comments and the additional issues brought into the discussion. And I must thank all panelists for their contributions and a quite wide range of concerns, which in fact need to be addressed based, of course, on your expertise and on the work that you are doing from your various standpoints. We have some time now for questions and answers. I have received a few questions, and I will suggest that we start with three of them, maybe three of them. I can read them and then give the microphone back to the speakers to hear their answers or comments on this. We still have Caroline Schela and Ana Sofia Fernandes in the room, so I will then ask them to address these questions, while still other additional can be put forward in the chat box. Oh, I have a message here. Okay, all right. So let me start with the questions, and then I can give the floor to people in the room. The first question would be the Secretary of State in her opening remarks, quoting the United Nations Secretary General, mentioned that COVID-19 has a woman's face. Now, my question would be, should we expand further efforts to make this face more visible to everyone beyond policymakers, experts, and activists? My question would be, how can we do this? How do you think that we can make more visible and more understood by the wider public the specific impacts of the pandemic on women? Because I believe that as much as these effects are indeed quite striking and quite out of discussion for us when we look into the data, still there's a huge world outside, and often this is not recognized as such. So I would invite you to say some words on that. Now, the second question has to do with unpaid care work. This has been mentioned by several of the speakers. Unpaid care work is unequally distributed between women and men. There's a lack of recognition of this kind of work. So my question is, what should be done immediately about this? So starting from this, the evidence that we have about this problem and how this penalizes women and is not valued for economically or sometimes even socially. So what would you consider the priorities or strategies to make sure that unpaid care work is more equally distributed and recognized as it should be? And the third question has been asked by an attendee, and it has to do with digital rights. Now, the question, I'm going to read it. Would you agree that in light of the digital requirements exposed by the current pandemic, that internet broadband access with reasonable download and upload speeds should now become a fundamental human right ensured by the state? The UN Convention of the Rights of the Child mentions that every child must have the right to an education, and this is being negated to many under the current circumstances. This has even a more impressive impact on the poorer communities, where a girl's role is to help sustain her family, and therefore education will be left further behind since they do not have the tools to ensure it. So let me, while I gather some more questions, let me give the word to Caroline Schreila to hear her thoughts on these questions.
Thank you very much, and thank you for those questions. I'm not sure that I will be able to respond to all of them, but maybe let me respond to the first one, because it also links to the work of EIGE. Because if the question is how to show the impact of COVID-19 on gender equality, of the COVID-19 crisis on gender equality, and it is true that COVID-19 has a women's face. I mean, if we look at the interventions and we listen to the intervention, it's clear that women are hit hard through the crisis. But I think one thing that's very relevant, and that's also what is the purpose of my institute, is to provide information and data on the situation. That's the first step. EIGE is a knowledge center of the European Union. So what we do, we collect information and data on gender equality in the European Union. And we share this information, first of all, of course, with the Commission and with policymakers at national level. And we do hope that they do use our information and data to develop policies at national level, but of course, also to share this information with, let's say, citizens, with all relevant stakeholders at national level. What we do ourselves as an institute, we have also a very vivid communication approach. So we share what we gather through social media, we put it on our website, we participate in important fora like this. So we try to share this information as widely as possible. And I think that's a very important element. Everything that we develop, policies we develop, actions we develop, they should be based on proper and reliable information. That's what EIGE provides to our stakeholders. Regarding the question, what should be done to make care valued and to give it a proper place in society? Well, I think I mentioned three proposals in my intervention. So I can quickly repeat them if that's useful. I see the moderator nod. So
yeah, please.
Okay, so what I said, what was the basic thing, of course, the statement in my speech is that we need to make care count, because it's, I mean, if you look at the figures, and if you look at the figures I also mentioned in my intervention, it's really amazing that care is invisible. Care at home is invisible, and it comes with a cost also to the economy. So I mentioned basically three things that we find relevant in EIGE, and that's a change at home, because we do see that men took up more care responsibilities during the pandemic, but it's not enough yet. It's a good sign, but we do feel that at home, at the kitchen table, as we say, people should negotiate and share the burden, if I may call it that way, or the challenge together to combine work and private life. And secondly, it's very important that member states provide affordable and professional care services. It's not the case in many of the member states yet. And it's very, very relevant. If you look at the aging population in Europe, if you look at developments, I mean, this is key. This is key for the future. It's key for now, it's key for the future. And the last thing I mentioned, and I want to repeat here, and I also experienced this myself, that when you need to provide care, it is seen as a professional and financial sacrifice, which is really strange. It's seen as a sacrifice, but it should be normal that people share, that they combine work and private life, and that's why we also say that countries should really make part-time work and temporary work, forms that are often used by carers, more secure. And I mentioned the fact that they should be done through proper eligibility for social security. So that's three things I mentioned in my speech, and I would like to repeat here. And I will leave it to that for the moment. Thank you.
Thank you very much. Ana Sofia Fernandes, if I can give you another word, please.
Yes, sure. Well, actually, this crisis has shown that the current economic model does not work for women. So we need to reconnect the dots. And the truth is, it has been women's unpaid care work who has been keeping society going in lockdowns. So basically, when everything had to stop, what kept society going was women's unpaid care work and paid care work as well in terms of health. So not acknowledging the centrality of women's work in a moment of crisis like this and translate it in concrete actions, which we call a care deal for Europe. We want to see in practice a care deal for Europe. With all this money that is being pushed to boost the economy, women cannot be left behind. And this is an opportunity. And we cannot let it go. GDP, as the usual indicator to measure economic development, actually in many countries integrates areas which we as the women's movement don't even consider should be there, like exploitation, women in prostitution. Why this is considered in national accounts for an indicator named GDP, when women's unpaid care work is not considered? It's very simple. because this is a patriarchal model. And we as feminists want to put back the feminist analysis in the center. It is possible to value this type of work. There was a study by the Secretary, a report 2 years or 3 years ago from the Secretary General of the UN, which made an estimate of how much worldwide this work means. And the fact is, we only don't do it because there is no clear leadership in saying we are going to do it. We need feminist economists on the table, rethinking, and we need the leadership of the women in decision making. Because it's more than obvious that when everything closed, when the lockdown reached us, many professions even could have disappeared and no one would notice. But caring for the children, caring for the sick people, caring for the women suffering violence, who did it? So it's more than time that we make this as the center point, the central point. And more than that, a care deal for Europe, besides centering this dimension, needs also to have funding for an infrastructure of care throughout the life cycle. In a society aging, we cannot have women again being the ones having to care for the older, friends, family, etc. We need quality in care infrastructure. So at EU level, we need to go further. We have the Barcelona targets. It's more than time to go to the Barcelona plus targets, the one that puts in place targets for care throughout the life cycle. Because women and men, we believe in a Europe, a feminist Europe, where women and men can both be workers and both be carers. And this is what we aim at. The traditional economic model, the breadwinner model, doesn't work. And it only took a pandemic to show this. Now, if the women were the most affected by the pandemic, and everyone acknowledges this, it's more than fair that we start making smart spending, gender budgeting, with all this huge package of investments that all member states are receiving. And unfortunately, I must say that women's organizations are reporting that in many countries, proper consultation with civil society, namely, and women's organizations in particular, is not happening. And women's organizations are very worried to see that the priorities that are being designed are not the ones they feel as the need on their daily lives. So it's very important that gender mainstreaming is there, but it's very important as well that we understand clearly from the entire package of money how much goes specifically to the needs of the women who were the most affected by the pandemic, and within all the other areas of the package, how is gender mainstreaming being done? Are there targets? Can we follow the money? Is there earmarked money? Because this is what women's organizations want to know, to understand concretely in every strand of the funding. Where does the money go? How does it answer the imbalances, the further imbalances that the pandemic has created? So it's time to rethink the economy. It's time to have a feminist Europe, and it's time for us to put and to center care through a care deal for Europe, funded with this funding that is now being made available and negotiated in the countries and afterwards with the Commission. Thank you.
Yeah, all right. Thank you very much. We have some further questions, including some of them on spending and on the national recovery plan. So I think we may get back to this in a minute. But before that, we have with us the Greek ambassador to the United Nations in New York, who was asking to speak. So I would now pass the microphone to the Greek ambassador, if that's possible. I don't know if our technical team can make sure this happens, because I wouldn't know how. So okay, so in a minute, I guess we will have the Greek ambassador speaking to us. So we'll not forget about that. So let me just get back to questions that have come out. A few of them on the national recovery plans, which I think can be addressed together. Now, of course, we know that neither Helen nor Anna Sofia are writing the recovery plans, but we also know that they are in a good position to give us their insights and reflections on this. So I think they can address these questions. They have to do with, of course, how the national recovery plans address or should address gender equality and discrimination of women and imbalances between women and men. One example is that of women working in the informal economy. So how can the concerns, how can the situation of women in the informal economy be addressed now, either in the national recovery plans or in the other way? I would even expand this question to ask you if you know of any good practice, of any exemplary practice being done or being carried out either by a national state or the civil society on supporting women in the informal economy. But there's also an attendee asking how can or how should recovery plans that are not gender responsive, or they turn out to be not gender responsive, how can they be sanctioned and corrected? How can we how should we go about this issue? Another question that from a participant that I will read out loud is the following. It's related with the role of the United Nations. Now we don't have a speaker from the United Nations, but I'm sure we can have some ideas on that. And I'll read out loud the question. What's the best way the United Nations can combat norms that make women do more emotional and unpaid care work labor? How do we try to change these harmful norms without attacking the institution of the family, which for many women is important? Now, I'm sure you have some ideas on this. Now, let me just add one more question, if I can, before I give the microphone back to the two speakers in the room. The question is, the question has to do with the impact of the pandemic on women related with sectoral segregation in the labor market. This has been addressed by several of the speakers, and I would like to invite you to get back on this. We know the labor market is segregated, so women and men are not equally distributed across sectors, across occupations, and this is one of the reasons why, one of the many reasons, but it is one of the reasons why the pandemic had different impacts on job losses of men and women, and also job recovery of men and women. Now, this occupational segregation, or we usually call it horizontal segregation in the research, is an issue that until now was recognized as a problem indeed by experts, but not so much by the wider public, I would say. This notion that, well, women and men are doing different jobs, but that would be seen as something quite natural for for many people. And I think that the pandemic actually showed us in a terrible way how that can be dangerous, and how sectors and jobs that are occupied by a large majority of women or a large majority of men can indeed can translate into a gender penalty in times of crisis. So my question would be, what should we do to tackle this? How should we intervene? How should we act to prevent occupational segregation, which is a complex and long-standing issue in our societies, as we know? So some ideas on that would be most welcome. So if I can pass the mic to Caroline, please.
Thank you. Well, that's a lot of questions in one go. So I think I would like to to turn to the questions on the recovery and resilience plans at national level. But maybe I would like to start with saying the following. I think that when the COVID-19 pandemic started, of course, we were all in a panic. We were confronted with a new virus that we didn't know. Governments decided to close the countries or to put countries in lockdown, and well, a lot of things happened at the same time. And I think this was all done to prevent people from falling ill. It went very quickly, and basically with good intentions regarding the health of citizens, but at the same time, and this is what we also mentioned pretty quickly as a research institute, as a knowledge center, with huge consequences, and mostly for women, being locked up in the houses, being, for example, victims of domestic violence, not being able to leave the house or to escape from this. But it also showed us, I think, the pandemic showed us that where maybe in many cases, when we talk about gender equality realities and we share data, we might think this is about others, but it's not true. The crisis has shown us that this can hit anyone. And I think this also relates to the question about the segregation in the labor market. Well, maybe people thought that they were in safe circumstances, job-wise. Suddenly, a lot of people saw that they lost their jobs. So I think this is also one of the things that was became more and more clear in this pandemic. Talking about the recovery plans, I'm not working in the Commission, so I don't know if there will be any sanctions if member states send in plans that are not gender sensitive. But I'm sure that if the Commission notices this when assessing the plans, there will be a good dialogue with the member states. I think it's extremely important that while drafting those plans, at national level, a good gender analysis is performed, because that's the basis of gender mainstreaming. You cannot draft a gender sensitive recovery plan if you don't know what the situation is in your country. For that, you need information and data. So I really sincerely do hope that member states see this as the first important step while drafting those plans. IG is more than happy to provide information. The Portuguese Presidency indeed asked us to look at the socioeconomic consequences of COVID-19 pandemic, and we managed to gather a lot of very up-to-date data, which is not always easy. So I would hope that member states use these data while drafting their recovery plans. And And when doing such a good gender analysis and a really solid gender impact assessment, and EIGE has all these tools on our website, that would be a good basis for drafting gender-sensitive recovery plans. And again, I know that the Commission will assess the plans, and I'm sure that if they're not gender-sensitive enough or gender-blind, there will be a good conversation between Commission and the respective member states. That's my expectation and my hope, of course. Thank you.
Thank you, Hannes, if I can ask you to comment, please, on the questions or any additional ideas, please.
Yes.
Can I
Well,
make a comment?
Well, we are worried with the proposals that some member states will do, because in fact, the information we have from our membership doesn't give us much hope that what Caroline was just saying, that there is a proper diagnostic made, will be there. And as we know, to do it, sex disaggregated data is the first step. And unfortunately, we don't see this many times done, be it at the member states in general, be it sometimes in the EU. But this is the first step to make sure we can actually analyze the reality. Otherwise, we are blind. We are following a model that is a male model, basically. And this is important because if we don't manage to do this now, we will lose the opportunity when we know that traditionally, when investing, which is a good thing for going out of a crisis, is investment. So when investing, traditionally, we know that investments go into male-dominated sectors. So investment is good, but the question is for which sectors the investment is going. And traditionally, they go into male-dominated sectors, like construction. Now, knowing that most of the women, because we have this segregated labor market, are in health, in care sectors, the point is, are we able finally to consider social investment as key for sustainable development in societies? Because the fact is, in the past, in times of austerity, even investment in social infrastructure was considered spending. And because of that, the public health systems in many countries were eroded, and now we have the problem with this pandemic. So, are we now ready to rethink economically that this is not spending, this is investment for a sustainable society? This is the key thing. Because right now we have this package. So the first problem is the package going to be allocated to the sectors that need the most, to the ones that were affected the most? And we all acknowledge it was women and girls. So this is the first question. And the second question is, in a few years' time, are we going to go back to austerity? So rethinking the economic model is putting all the pieces of the puzzle together now. And this is one of our main concerns, and that's why our Purple Pact, the one launched last year before the pandemic, we believe it's a key instrument to answer all the inequalities that existed before, are now exacerbated, and that we risk having in the future again. If we don't reconnect economic and social and environment as well, because it is all connected in the end. It's all about patriarchy and using the resources as if they were infinite, from women's work to the environment, to the planet. So either we reconnect economic, social, and environment, and we finally accelerate towards sustainable development, or we'll have, I don't know, but I don't have, or it cannot be more of the same. Basically, this is it. Women cannot stand anymore. All the women's resources were strained to the limit. It's impossible. A society that does this to more than half of its population. It's more than time to acknowledge this, to make it center. And we hope that all the countries like Portugal, who put this very central in its agenda, and all the other like-minded countries could work with women's movement in their countries to embed the recovery and resilience plans with women's experiences on the ground. Otherwise, it's even democracy that will be at stake in the future. The EU needs to work for the entire population. And equality between women and men, it's in the treaties. Since the foundation, actually, equal pay. Since 97, from Rome, we are in 2021. We had a crisis of this dimension because gender equality was not yet there. So now is the time to do it. We call for action from all political leaders and in partnership with women's voices and the ones that were most marginalized by the current economic model. That's it.
Yeah, and I'm sure that well, I believe, and I'm sure that women's organizations must indeed be ascribed a key role in the implementation of many of the things that we are that we have been speaking, and they cannot those measures cannot succeed otherwise. That's a very important point to keep in mind. We are approaching the end of our session. I would ask if the Greek ambassador can take the microphone now, if it's possible. Because this was not possible some minutes ago, but maybe now she can. Let's just.
Doesn't seem to be.
Okay, I think it will work now. I can see. Yes, please. Yes.
Hello, and I am so sorry for all this. I was on the phone with my Minister of Foreign Affairs. First of all, I want to comment on this very, very interesting and timely event organized by the presidency and to comment on all these excellent interventions of our panelists. As the pandemic has shown how hard women have been hit, but like in the Pandora's box of Greek mythology, there is hope and promise to build back better. This is why we should enhance the gender dimension in all actions related to recovery. For Greece, education is the key of, in this respect, to address the structural root causes of gender inequality. How can we use education on every level in a socioeconomic, gender responsive and responsible way? Thank you.
Thank you very much. Thank you very much for your comments. Let me just in the few minutes that we have left, just get back to a few issues brought up by the attendees, directed to our speakers, even if we don't have time to go deeper on this issue. One of the participants asks whether the European Institute for Gender Equality has numbers on the value of unpaid work per country. So it's quite a detailed question. Maybe I can yeah, we can answer. And then one other participant asks or suggests if that the United Nations should the United Nations take the initiative to restructure how national income is measured beyond classical and monetary standards. So I think this has been answered implicitly in the comments before, not necessarily this or that institution, but in fact I think this is something that we have been working on and should go on working on. So if I can just give the word to Carleen and to Anna-Sophia for their last comments, if any.
Well, the 9 trillion euros it's indeed the amount I mentioned, and I don't have the figures at European for each and every country separately, but I would like to refer you, the person who asked this question, to the website of ILO, where you will find the report, and I expect that there you can find the differentiations per country. So we took it from an ILO publication, but it's 9 trillion euros indeed. That's what I mentioned in my intervention. Thank you.
Great, thank you very much, Anna-Sophia. If you have any last minute comments.
Yes, on a subject that is not really EU competence as such, which is education, but since the question was raised, and I think it's a very important one. Actually, I would like to remind us all that the first ever international juridical definition of sexism only happened in 2019. And this is important because it was from the Council of Europe, and it mentions specifically several sectors, and education is one of them. And this is important because sexism and violence against women is mutually related and influencing each other. And therefore, I consider this recommendation to be key to be used by the member states. Personally, this is not an area that at EWL we have been working because it's not so much in the EU competence. But since the issue was raised, yes, education is key. And educating boys and girls since a very young age to autonomy, and by autonomy I mean not being dependent on others, to have food, to care. So this is a competence that actually schools should foster in youngsters. And that's it. Only thing. Thank you.
So it's time to finish our session with I think I speak for all when I say that we leave with a number of concerns and that maybe we didn't have at the start, but also with a variety of recommendations, ideas and proposals. And I think the session has been quite good in providing not only diagnosis of what is happening, but also some ways forward that are indeed, some of them being taken and some others hopefully to be taken in the near future. So I thank the State Secretary, the Commissioner, and all speakers and attendees. And I hope it's been a fruitful occasion to learn and reflect to all of you. I remind you that the event is available to rewatch on YouTube, and feel free to circulate this information to women and men who have not been able to watch live due to other responsibilities and other time time standards too. Thank you very much again, and the best of luck in the times to come.
Thank you.
Thank you, Anna.
Thank you so much. See you again